Heidi, what's the prognosis on this kind of stuff? I mean, I get it. If you've got sort of massive head trauma, then you got bigger problems. But for the for the folks who the concussive blast and I had a concussion playing football, or in my case had a sailboat boom hit me on the head a couple of times. Like is this the sort of thing that you eventually overcome and walk away, or is this the kind of injury that's always going to leave a mark?
The hard answer to that is it depends. It depends on a lot of things. It depends on when the injury happened. It depends on how frequently that particular area of the brain continues to be injured. The force of the injury. I mean, I know a woman, she literally was just walking and not paying attention and literally ran into a pole. It sounds like like you'd see in a cartoon. And she said, I was actually interviewing her son as a Blue and Gold officer. And we somehow had this sidebar conversation about this. And I said, you literally live on Belvoir. I'm asking you, please get over there to the Intrepid Center that we have and get yourself evaluated and get on that road to recovery. So I think the earlier the intervention, the earlier you get seen after an incident, or even just a series of incidents. And again, the documentation is so important, making sure that's logged in there in your records somewhere. And so that way that diagnosis can get there. But yeah, once you can get that referral to get to, that type of treatment, then there's a whole host of other things that they can do once they get you there. But half the battle is just, number one, recognizing there's an issue, and number two, being able to get seen and get that diagnosis. That's really critical.
And if I may, a follow-on question, the treatments, are we talking about things that basically create space, like the lights and the quiet and that sort of thing? Or are there, I don't know the right words, sort of specific medical interventions that happen, drugs or what have you, that speed the healing process?
Well, there's a host of different things. They're going to go through a number of evaluations. You can have vision issues, hearing issues, all kinds of other things that are linked to TBIs. It just sort of depends. Again, each person is a little bit different. They'll have, say, memory exercises. I know this seems very counterintuitive. Same guy who was a cop, who became a cop, who was a Marine, he actually did boxing training. Why? Okay, not because he wants to get whacked in the head again, but because he would memorize a series of movements, and that's kind of helped get his memory back. Or the guy who was training the therapy dogs, he had to memorize commands. He had to like be kind of peppy, dogs reflect the mood that you have. So, you're doing something that is causing your mind to sort of remap and help you get there. So I think, again, if you're just sort of,
that makes sense,
wallowing in your pain and not doing anything about it, that's one thing. But if you're trying to find something that's going to work, and it may take a lot of trial and error. That's the tricky part about it, is that there's just a lot of different examples, and that's why what's so interesting about the different little videos and different things that we have, that have yourself a little movie marathon one night and just kind of check out the different stories, and we hope that just something will resonate and someone be like, yep, that's totally me, or I know someone who that's happening to, or you know what, I might suggest that to so-and-so and that might work for them.